Okay, hey guys. So today's a real quick, real simple one. We're going to talk about history taking. We're going to go over OPQRST and sample or ample history, whichever one your book tells you to do. We're going to hit real quick on which each one means and easy ways to remember it. So let's get started. Once again, my computer doesn't work. Okay. Um, so OPQRST. O is onset. So what is happening or what was happening when it started? What started the problem? Um, P, provocation. Does anything make it better or worse? So for instance, you run on someone who was outside mowing in the heat. They started having chest pains. They went in and they sat down and cooled down. Now they're fine. Um, or did they go in, cool down, and it still hasn't changed? Nothing has made it better or worse. There was no change. Um, a lot of the, I mean, I kind of use cardiac a lot for that one because that's just what it reminds me of. Q, the quality. What type of pain is it? This one's a little confusing to a lot of people, including myself. Quality is it stabbing? Is it dull? Is it sharp? When someone's hurting bad enough, they don't care what type of pain it is. They're just hurting, right? So this is kind of hard one to get people to answer sometimes. And that's usually how you need to word it if you're with a patient is, can you tell me about the pain? Is it a stabbing pain? Is it aching? Is it dull? Um, Describe it to me in your words. It's a good one to go to. Let them describe it to you how they feel it, not how you're leading them on to answer. R is for radiate, doesn't move from its original location. Man, I started out kind of feeling like I had heartburn or tightness, and now my shoulder's hurting, my neck, and even my jaw is hurting. That would be signs of cardiac, right? So that pain started and it moved. It moves to other locations. Remember that what I described is a lot of male patients with heart attack symptoms. Females will be lower back pain and even abdominal pain. Um, let's see. So pay attention where it radiates to, ask questions, get their input. That's super important. Not in your book. This is me telling you what I do in real life. It is overly important to let that patient tell you what they are feeling. Yes, we've read it in book. We know what you're supposed to be feeling, but what are they feeling? Let's see. S is severity. How bad is it on a scale from 1 to 10? If you get someone who is just absolutely dying, they're going to tell you it's a 50 or it's a 13 or it's a 12. Most generally, you can get an honest answer out of them, but you are going to get those ones who want to be smart alecks. It's very simple. No, I really need a number because I have to relay that to the hospital. 1 to 10. If you're hurting and you say it's a 13, does that mean a 10? This is the worst you've ever hurt in your life. Don't be afraid to coach them because you need accurate information. Um, T for time. When did it start? Do some quick math. How long have they been in this condition? So OPQRST, best practice I can tell you, especially if you're just starting out and all this is still just mind blowing to you. Every day, 3 times a day, write down on a piece of paper OPQRST, write down the word that correlates with the letter, and then beside it, in your own words, don't copy me. In your own words, what does each one of them mean? What was happening when it started it? You can simply put what was going on, what caused this, whatever helps you. Um, 3 times a day, write down OPQRST, write down the word that goes with it, each letter, and then write down what each word means in a medical, like what it means if you're questioning a patient. You do that 3 times a day. From here on out until you're done with school, you will never question history again. It'll be there. You'll just know it off the top of your head. And same practice for sample or ample. I know some books have taken the S out. I learned it with samples, so that's how I teach or how I help people. So sample, S is the signs and symptoms. And I've said this on some other videos. A sign is something you can see. So a sign, think of a stop sign. You can see it. It's big, it's red. You better see it or you get in trouble, right? So signs are something we see. Symptoms are something we're told. We can't see my headache. Hey, guys, I have a headache. Is that a sign? No, that's a symptom. I'm telling you. It's something you don't see, but I'm telling you. So know the difference between a sign and a symptom. Sign, stop sign. Easiest way to remember it. A is for allergies. So why is it important that we know what allergies they have, especially medication allergies? Because if we jump in the back of that truck with them, or you call ALS and I show up and I'm going to push Toradol, and they're allergic to Toradol, but you didn't get that information, and neither did I because I didn't do my job right, we're in trouble, right? So, hey, you allergic to any medications? A lot of people will tell you even their food allergies, but you're going to find a lot of people like penicillin allergies or codeine allergies. Be sure and write that stuff down. We've talked about this in some other videos. Um, all information needs relayed. I know it's a whole lot when you're dealing with a patient and family and you're trying to get your vitals and do your job, and we've got to take a second. Someone needs to be writing down information. So allergies are very important to write down. Medications. Yes, we need those. Do you need to write them down? Not if you can grab them and take them with you. And be glancing at them, have your medic look at them, whatever. Ask questions when you're doing your patient assessment face to face. If they're alert and able to answer you, do you take blood thinners? Are you on any medications for hypotension, hypertension? Are you a diabetic? Do you take insulin? Ask those questions. That's part of our job. But it is important that we either write down or we take medications with us to the hospital. P is for past pertinent medical history. I myself I don't lead them on, but I also don't let them give me their whole life story. Hey, have you ever had any cardiac issues? Did you have COVID? Have you ever had anything respiratory wrong with you? Have you ever been in a trauma where you might have broken bones or had head trauma of any kind? I don't care that you had knee surgery in 1765 and you're 200 years old. I don't care. What I want to know is past pertinent history. What do I need to know right now? So you can kind of guide that if you need to, because there are them people out there who, if you give them that open door, they're going to tell you every splinter they ever got, every cold they had, and they know it because they've got a journal that they've written everything in that you're supposed to read, according to them. So I'm not saying answer for them. I'm just saying push them in the right direction. So last oral intake, there's a couple of reasons this might be important, especially in like a diabetic patient or in someone who might be septic, or someone who's going to ortho. If it's a trauma and we've got bones sticking out and we're headed to a surgeon, I need to know when you ate last, because it's, we all know you're not supposed to eat before surgery. So I need to know this. There's certain, milk reacts with certain medications, alcohol with certain medications, even water. Some water will react strangely with certain medications. So it's important to know what that last oral intake was and kind of roughly what time. And then E is the events leading up to the current situation. What was you doing when this started? If they're sitting in their chair watching Jeopardy and they get this intense 10 out of 10 chest pain that feels like someone's stabbing them, I've got a problem. If they're outside cleaning the garage and it's 110 and they get short of breath, yeah, they're in trouble, but I'm not going to be near as worried because there was something there that indicated that happened. There was a mechanism of injury or illness that I can kind of start with. So this events leading up to, this kind of helps draw that picture that you need in your mind of what happened and get you on the right track to treatment. I think, yep. Okay. So that was it. That's your two histories, OPQRST and sample or ample. Like I said, I'll say it one more time. Write it down 3 times in a week. Fill it out. The letter, what it stands for, and then in your own words, a little definition of that. If you do this, just like I'm teaching you how to do the rest of your assessment, you won't ever stumble. You will know it by heart. I promise. It's how I did it, and I am not good at doing things in order. So thanks, guys, once again for sticking out with me. Please, if you're watching these videos and I am helping at all, reach out, send me a comment, tell me what chapter I can help you with, because I'm just kind of pulling stuff out right now. Let me know. Let me know what I can help with so I can start doing some positive videos. All right. Thank you guys, and I will see you on the next one.